Welcome back to the Patriots Wrap. We have another in-studio guest with us tonight, and it is our friend Dr. Paul Fedeli from Brown P. Bruins University Orthopedics. Bills fan. Am I missing anything?
All there.
Okay, Doc. Well, your timing, like I was saying, couldn't be any better because Danny Amendola, there's some conflicting reports out there. Let's start out with the Fox Sports report that he has torn adductor muscles. Is that how you say it?
Correct.
And what would that mean exactly to people out there if you're saying he has, is it on his hip? Is it a groin situation?
So does he have a sports hernia? Is it an adductor injury? Did he tear the groin muscle itself? This is the evolving area of sports medicine, is what does this all mean when an athlete pulls muscles deep along their hip joint? And it's really not just connected to that. It goes all the way up to your core muscles and into your abdomen. And so somewhere along the way, there's been an injury and damage in there that isn't really fixed quickly. We may cover it up with a shot of Marcaine to get you through a game, but long-term healing will take a long time. So if that's where that injury is in his adductor muscle, it's part of a bigger chain, kinetic chain of problems that will take a fair amount of time to heal.
Yeah, you mentioned the amount of time, and I know that's pretty much what everybody is kind of worried about. Are we looking at least at a month, or does it depend on how much the muscle would be torn?
I think it depends on how much that muscle is torn, and obviously every time he goes out to play, he's going to tear it a little bit more, and there is no end point, so the surgeons can't put a screw in there, or there's no pill that'll make it go away. We can numb him so he doesn't feel that pain, but we can't fix him, and so I would bet that the training staff and the medical staff will be dealing with this through most of the season.
If it's just pretty much a straight-up sports hernia, which there's some reports out there, and everyone's a little bit afraid of surgery at this point, but would that almost be better than dealing with a torn adductor muscle throughout the entire season? Well,
it depends on what his diagnostic studies show, but for most athletes, you'd rather treat this as conservatively as possible. Again, assuming it's in the adductor musculature. And we always have to worry, lurking behind that, is something's in the hip joint itself, as these two areas overlap one another in the human body, and we can be fooled. So sometimes the athletes get second, third, and fourth opinions just to make sure.
Moving on to the baseball side of things, we also have a big injury with Jacoby Ellsbury. I'm not even going to try to say the bone that they're saying is a hairline fracture. He fouled a ball off his bone. They still think he can come back. If there is indeed a fracture on the top of his foot there, is it realistic to think he could come back in time for the playoffs?
Sure it is. So here's a man who has to run. He's got to move, and he drops a ball that bounces off his navicular. What we don't know is what the word fracture means. You and I know what that means. It means the bone's broken in half and you're out, but that's not really what this gentleman did. So Jacoby probably cracked a little bone on the top. Maybe there's a little avulsion injury. That's a totally different injury. That's something that medical team can work around, a little protection, let it calm down for a little while, and then get him back. That's not the cast or screw fixation that'll go on 6 weeks or longer.
And you mentioned the screw situation. Dustin Pedroia had a similar injury 2 years ago, and he actually, I believe, came back and played 2 games. Then they shut him down, decided to put the screw in his foot. How do they avoid that with Jacoby Ellsbury? Is it something that you think they would risk again, putting him out there, or would the doctor say, no, he can go out there and try to play?
If that fracture is pulled away, separated, displaced is the word we use, then there's more likely a chance we're going to fix it. If it's sitting just perfectly and nature will heal that, then no surgeon wants to touch that patient, just back it down. And if it's really a tiny little fragment, again, the risk of displacement, minimal. The risk of returning, small. So that's all based on his diagnostic studies.
And I think any Red Sox fan out there loves to hear that Jacoby is going to come back for the playoff stretch. We'll kind of keep an eye on that, and I'm sure we'll catch up to you very soon. Congrats with your Bills today. That was a nice victory.
I'm a Buffalo Bill fan because I'm from Buffalo.
Well, there you go. Easy enough said. All right, Dr. Paul Fedeli in studio once again. We'll be back with more after this.